Welcome everyone to the fifth webinar in the main event series, The New Normal, How to Plan for Safe In-Person Events for the U of T Events Professionals Group. So before I introduce myself and the speakers, I would like to acknowledge the land on which the University of Toronto operates. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and most recently, the Mississaugas of the Credit River. Today, this meeting place is still the home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work on this land. I am Archana Sridhar, the Assistant Provost here at the University of Toronto. I'm moderating this discussion and I'm stepping in for Bryn McPherson, who is unable to join us today due to some unforeseen circumstances. Bryn has told me amazing things about all of you and this event series. I'm excited to be here. As Assistant Provost, I've been working closely with the COVID-19 incident leadership team at U of T for the past few months, so I'm personally very interested in today's discussion and what the panelists have to tell us about. So this panel is envisioned as a way to close the formal events of this series, and we purposely waited to host this later in the summer because the situation has been so fluid with new announcements about COVID that are radically changing our operations, sometimes even day to day. Now that stage 3 has been announced by the province, even though Toronto's not there yet, this should prove to be a lively discussion given the work that all of you do. And we know that stage 3 is just the start of restarting larger gatherings, with the terms of stage 4 still yet to be announced. So we convened this panel to have an open dialogue about how we can safely begin to restart events here at our institution and learn more about what's happening in the city and the province. And so to begin, I'd like to introduce our panel in alphabetical order. First, we have Chad Jankowski, Mental Health Programs Officer in the U of T Faculty of Arts and Science. Chad is here to provide a lens into our perceived safety and the perspectives of event attendees, as well as organizers and staff. Next, we have Dr. David Mowat, Public Health Lead in the Toronto Office of Recovery and Rebuild, and Adjunct Professor in the Dalla School of Public Health. David will be speaking with us about the public safety of our events based on city and provincial guidance and his expertise. Next, we have Rob Oliver, Health and Safety Consultant at the Public Services Health and Safety Association. Rob is writing the guidelines for employee safety, and so his advice will be useful for all of us working events and for our staff. And finally, I believe we've been joined by Gina Trubiani, Director of Occupational Health and Safety in the U of T Environmental Health and Safety Research Oversight and Compliance Office. Gina can help us understand how U of T is guiding us in this transition period. So just a few words about the format for this panel and webinar. I'm going to ask each panelist to first answer one overarching question. There'll be no formal presentations. Rather, we're really going to focus this on a conversation. And then I have one or two questions for each panelist to get our discussion going. And in their answers, we've asked the panelists to give us some practical tips for many of you who will be implementing events in the months ahead. After that, we'll open the floor to your questions. So please submit your questions through the Q&A feature in the Zoom meeting chat of this session. And that will be moderated by Laura Muldoon, Senior Partnerships, Engagement and Project Officer at the School of Cities, and Nini Brody, Manager of External Relations and Outreach at the Daniels Faculty. They were responsible for organizing this panel, so I'd like to thank both of them. And we plan on ending promptly by 3 p.m. Okay, so here we go. Here's my opening question to each of the panelists. Given what we know today, what do you think resuming in-person events looks like? And from your particular field of expertise, what are the most important considerations that events professionals should address? Why don't I begin with Chad? I'll go in the alphabetical order that I introduced you guys.
So, sure. I mean, I think I may keep this short as an introduction so we can get to some of the more physical safety components that we want to be thinking of as event planners, because really what I'm hoping to do is kind of layer on a piece around kind of our mental health and safety and well-being, and bring that lens to the conversation. When I think about kind of what resuming in-person activities and events looks like, I mean, certainly I think we're looking at a hybrid model, and creating opportunities for people to have rich experiences at our events, regardless of whether they are attending in person or accessing through digital and virtual means. When I think about our considerations and where we need to be kind of bringing our heads around to thinking about how we create spaces that feel safe and welcoming for our community, there's a few things that come to mind. And first is just kind of a recognition of what we've all gone through for the past many months. The onset of a period of acute stress with the global pandemic, the reality hitting home, and then that gradually turning into a period of chronic and ongoing stress. And recognizing that we all had our kind of worlds turned upside down and disrupted, and a loss of routine, and that posed real challenges for our executive function and our ability to do kind of higher level work. And some people were impacted more than others by that, right? Based on coping skills, situations, but also pre-existing diagnoses around mental health conditions, right? And how we recover as we start to, reintegrate into this modified way of doing things. How each of us recover looks different for every person, right? How we manage the grief and deal with the loss and manage kind of returning into this world and thinking about what levels of anxiety and stress that induces for us is going to look different for everyone. And so first and foremost, I would say thinking about and recognizing that people are going to have a range of experiences and a range of comfort levels with re-engaging in-person activities. And so wanting to make sure that we're creating spaces where they can fully participate on par and have equal experiences with those who are attending in person. When I think about kind of events that I've planned and the work that you all do in planning and executing events, I think we don't define our successes just on kind of butts and seats or the number of people who logged in, right? We're defining our successes around kind of the experiences we're able to curate for people, meaningful learning, opportunities for connection, and thinking about those pieces and considering that as our goalposts can help guide us in thinking about how we create spaces that welcome folks. Part of that for me, if I can offer one kind of practical tip at the outset, and I'll circle back with more in a bit, but the one I would start off with is thinking about what does it look like to reach out and connect with our attendees and participants and gauge what their comfort level's at, to share with them what are the pieces and precautions that we put in place as event planners, and how are these resonating with you? Is this enough to make you feel comfortable? And acknowledge that it's okay if that's not it. And elicit from them kind of what would allow them to feel more engaged, to feel like their needs are being met, and to do that kind of work up front, as well as some assessment at the end. So we've got this kind of pre-post assessment opportunity that we can then go and have an iterative process where we're continuously making our events more accessible and meaningful for folks to attend.
Thanks, Chad. Yeah, those are great points. I've also been thinking a lot about the importance of flexibility and in terms of the different places people are coming from. Why don't I next ask Rob, can you share your perspective on this kind of overarching question?
Yeah, sure, absolutely. First of all, thanks very much for inviting me to speak here today. I think this is a very, very important issue, obviously quite timely. I think that the first thing to comment on, my background and what our organization deals with is providing information and guidance to the government in terms of these guidelines and things like that. So I have certainly been one of many that's been involved in drafting these things. One thing I want to point out is that the initial piece of your question was given what we know today. Yeah. And one thing that I really want to stress is that this is a very, very fluid situation. There's new information, new science that's being released all the time in terms of what's appropriate, what works, what doesn't. In fact, just this morning, I received a scientific brief from the World Health Organization on the implications for infection prevention precautions. So the World Health Organization is constantly updating information on what the science is saying worldwide on appropriate steps to take as we move towards this new normal. All right. In terms of the most important considerations that I think that the event professionals need to consider, there are really 4 or 5 overarching principles that we always need to keep in mind. And my goal is related to occupational health and safety. So I'm focused on the health and safety of employees, staff working for the University of Toronto. But of course, whatever procedures are put in place for employees are also, there's going to be a spin-off effect for participants. And I think that when we go into planning for these types of in-person gatherings, we need to keep in mind physical distancing requirements. So however that is achieved, whether it be physical barriers, floor signages, things like that, to encourage it, then that's one thing that needs to be considered. Hand hygiene is another. And so at events, it is a very, very good idea. I would actually require it that there are hand sanitizing stations available for participants to utilize. Face coverings is an issue that right now in the province, and including in the City of Toronto, is a requirement for indoor gatherings. Always follow whatever the Ministry of Health is advising, or your local, the Toronto Department of Public Health, because they're going to be basing their recommendations on current data that they have. All right, so we always want to be current, because if we're going to plan an event for September, the requirements that are in place then may be different than a similar event in December. So we need to be aware of that. And then the 5th and final point would just be enhanced cleaning. So making sure that surfaces that are touched, main contact points of people touching things, that there are people available to actually implement some sort of an enhanced cleaning protocol. So those would be the most important considerations I can come up with at this point, as far as mitigating risks to staff and volunteers and that at your events.
Thank you, Rob. Those are great, and I really am grateful for the practical advice too. Those. Yeah. Next, David, maybe we could hear from you, from your perspective, working with the city and in your scholarly expertise, a bit more from your perspective on this question of, more generally, what do you think resuming in-person events looks like, and what are some of the most important considerations to take into account?
Well, I'll mention 2 perspectives to start. The first is of the participant. And if you're like me, you love to go to conferences and events and meetings. And the bit you especially look forward to is when the session's over and you go out and meet all your friends that you haven't met for a while, and have a good chat with them and wander around and mingle. And of course, that's not going to be happening. So from the point of view of the participant in the in-person event, things have changed. And for the organizer, on top of all the usual stuff about the program and the speakers and the right size of room and so on, now they have to also worry about and plan how they are going to make this a safe experience in terms of reducing the probability of transmission of COVID-19. So for them, it's another plan, and it can be a very simple one, and it can be based on a lot of plans and protocols that are easily available, either at U of T or TPH has lots of them, and can give general advice as well. And the things that now have to be done before you start would, if you look at distancing, for example, blocking off rows, perhaps, the tapes for the direction to people to move, signage, all of that's got to be done beforehand. And in fact, you've also got to look at how many people are going to be in your auditorium. Because it has to be the lesser of 6 feet between everybody and the cutoff number, which is now 50 for an indoor event, but that could go up later on. And worry about how you're getting those people in and out without them all getting mixed up and too close to each other. And do you really want to be on a floor where a lot of people have to come up and down by the elevator? What are you going to do about masks? Well, that's been largely decided for you. You're going to have breakout groups, multiple groups. Do you want to cohort them and keep them all together to further reduce the mixing? And lastly, and this is not by no means a comprehensive list, to make sure you've documented the attendance and you hold on to that just in case there's a case or an exposure. And then Toronto Public Health will be on to you looking for a list of all the people who were there. So that's the kind of thing you have to address. Realizing that, when I think about the literally hundreds of places we look at in terms of let's make them safer for COVID. It's, as we've got the experience, it's very clear now where a lot of the risk is. So if you take a situation where you have contact, but it's close contact with a lot of people for a long time indoors, and then add alcohol, you have the bar problem. And we've seen it last weekend in Toronto, and we've seen it in the US. We have case of one bar, one night, 165 cases. We've seen this same problem in certain countries in Asia. Now, you've taken out the alcohol, but you've still got all of those other elements there. So it is something that needs to be taken seriously. Fortunately, right now, we have a very low rate of transmission of the virus in Toronto. Were that to go up, then you'd want to be even more sure that you are doing everything you can to reduce as much as possible the risk in the particular environment in your event.
Great, thank you, David. That's really helpful. And that may lead to some of the questions that we may have about food and drink and some of those aspects of many of the events that happen at U of T. Gina, can I turn to you next? You're joining us by phone. I'd love to hear your thoughts on this question from the perspective of U of T's specific planning.
Thank you so much. Are you folks able to hear me?
Yes.
Fabulous. Okay, so thank you so much, and it's such a pleasure to be a panel member on this call. I greatly appreciate it, and I know that there's many people on the call as well that we've already connected on a myriad of different issues. So as a general overview and introduction, as government regulations and public health advice continue to evolve, the university, of course, is looking ahead to resuming operations of events planning and provision of event venues that were closed due to COVID. In so doing, the health and safety of the university community has to be a priority and appropriate measures put in place. Such measures will take into account factors including, of course, our legal obligations, public health advice, and operational considerations. The university will need to put in place measures to protect the health and safety of its faculty, staff, students, contractors, and other members of the U of T community who frequent our spaces, and to provide reassurances to community members who may have concerns with regards to COVID transmission. In consideration thereof, we've developed a series of different documents institutionally. And specifically, my team has put together a robust set of events guidelines that we have been working tirelessly on, and in collaboration with a number of different groups across the campuses. And the guidelines themselves outline strategies for making events ready for reopening or increased occupancy, and for addressing the needs of employees and others who will be returning to the workplace. The guideline is also a consolidation of various tools and resources from the university and other public health authorities that will be useful during resuming of events on university premises. For general workplace guidelines, and again, many folks already know this, we do have a very robust, substantive employee general workplace guideline document available on the COVID-19 HR Leadership Toolkit. And in general, the strategies and best practices best set out specifically in the general workplace guideline, but specifically the events guidelines, are meant to be applied, of course, once there's been approval to resume with a particular event and or activity, and that all applicable university processes have taken place with regards to the approval of the particular events. So such approval, of course, is necessary to ensure continued institutional compliance with legal obligations and public health advice. Events must be approved by our central HR working planning committee. And again, once we go ahead and launch our events guideline, which we intend to do as soon as is possible, there's going to be a set of tools within the events guidelines themselves to provide guidance and advice on how best to plan for all of these substantively important variables that need to be considered in order for the resumption of events to proceed safely. So the university is looking to provide this events guidelines to all organizers of events to inform event organizers of the university's expectations. The guideline works in conjunction with our university COVID-19 general workplace guidelines, and a copy of which is available on the HR Leadership Toolkit, and we can also provide those to event organizers as well. And so my hope is that I'd actually like to keep the overview and stop right there, because I'm very excited about questions that might be coming in. I'm very excited to have the other panelists. I think this is a fantastic event, and so I'm going to go ahead and leave it there, and I'm happy to answer any questions as they arise, specifically with regards to how the university is engaging in a dynamic and iterative way to be responsive to the particular needs, specifically with regards to ensuring events proceed safely. Thanks, Archana.
Thanks. Yeah, thanks, Gina, and thank you for you and your team's hard work. That's really great. One question coming in from folks is whether you're able to link to some of the documents. I don't know if everyone can see the chat right now, so maybe what we could do is undertake to either, if they can't be seen in the chat to everyone, we can undertake to send out some of those links to the attendees afterwards. Thank you so much. So I'm going to turn over to Chad again for a specific question for you. Beyond ensuring the physical safety of everyone involved in the event, you spoke a little bit about some of the psychological factors. And I know you just sort of mentioned a few, like anxiety, for example. Are there other psychological factors that should be considered? And are there any practical tips? I really liked what you said about doing like a pre and post questionnaire, for example. Any other tips that come to mind in terms of making event attendees feel comfortable?
Mm-hmm. Yeah, I mean, I think when I think about some of the challenges that people are facing, everyone, regardless of their situation, has been internalizing messaging that staying home means staying safe. And therefore that not staying home means putting yourself at risk, right? And when we're thinking about event planning, that's something that we have to contend with. And participants who are considering participating in person as opposed to online are kind of weighing those and trying to gauge the level of comfort. And so much of that is going to be influenced by the degree to which you as event planners are able to demonstrate that you care, right? And a lot of that will come down to really explicit, ongoing, and accessible communication around the strategies that are being employed to keep people safe, and an acknowledgement that there are alternate ways of engaging if you're not looking to participate in person, and that those ways are going to be comparable and meaningful and enjoyable experiences for folks who are are joining online. And part of that is also that's bringing an equity lens, and I think that's something we ought to be doing with all of our work, regardless of COVID and global pandemics. When I think about strategies or tips, I think the pre-post stands out for me. That kind of ongoing and regular communication, making sure we're having kind of hybrid events stands out as well, and doing check-ins with folks, right? Creating opportunities during events to check in and make sure folks have knowledge of, and that you're communicating through events, what resources are available, right? The ability to demonstrate that you care, even if you're not saying that your event is causing any challenges, but you're taking this opportunity to remind folks about the resources and supports that are available, whether that's, if you're hosting a community event, what are the community resources? If it's a U of T event, thinking about, the EFAP and or student crisis response and support. So people are reminded that it's okay to be feeling a little icky, right? And that people are going to have a range of reactions, that it's also okay to engage in some of that help seeking. The other kind of practical thing that I would throw out is really just about managing your own expectations of yourself and what it means to run an event. For some of us, there's a lot of expectation and hope that a return to in-person events means we're going to feel a sense of normalcy. And that may not be the case. In fact, there could, folks who come out and participate in events may actually experience a sense of disappointment, right? That they're not able to go out for those drinks after the conference, as Dr. Mowat was saying, that they're not able to come close, that they feel like they were, isolated in a sea of people during that, right? And so naming some of those experiences and for the group can help, but also being mindful of them with you and your team and your planners, that's something that folks may experience, and that's not a reflection on you having done poor work. That's a reflection of you having taken steps to help ensure physical safety.
Yeah, I think those are really good points, and I like touching on the idea of a sense of loss or a sense of grief. I think that's something we'll all be facing. For David, could you tell us a little more about your work with Toronto Public Health and the Office of Recovery and Rebuild, and specifically guidance they may be issuing for universities and the unique kinds of events that we have here?
We're certainly in the guidance business. We're like the Costco of guidance, I guess. We have many lines in the guidance business. We have done three very general sort of introductions to guidance, where we try and lead people through some assessment of their own risk and their own circumstances, realizing that for a very large portion of employment in Toronto, the business employment is basically an office. And so that will cover that. We have a second type of guidance, which is the city's programs themselves. And they're very diverse, of course, and they all have, particular challenges. And the third one is the voluntary sector. And we certainly find they've been thirsty for the help with the kind of work they do. Again, it's quite diverse. And then there are what we call the really challenging ones. I think the first really challenging one we did was to see if the city was going to run its children's day camps again this year, and enormously complex for a variety of reasons. First of all, they're children, and won't necessarily follow instructions in the way adults will. They have parents who are anxious and so on. So that was very complex. Another one, restaurants, of course. Places of worship has been quite a challenge. And there are many, many more. And then we also have what we call the modular ones. What's stuff everybody would want to know? Like, okay, cleaning and sanitizing. Elevators. those kinds of things. So we have all of that. When it comes, and we deal with a lot of people who are seeking advice, or in some cases seeking approval. And we have to make it clear that, you know, Toronto is so big. There's, you know, every time of business, there's hundreds of them. We certainly can't be in the approval business, but we can provide help. And then we have others who are large and have a lot of resources, like U of T, and a lot of expertise, where they do a lot of this work themselves, and they're perfectly capable of doing it. They might send us a copy, they might not. So we have worked with U of T and other universities, starting with the Mayor's Task Force that had a Higher Education Institutes Working Group. Right now, we're engaged with the Academic Institutions Task Force, which is all of the universities and colleges in Toronto. That's mainly we're responding to requests, and that's entirely appropriate. We at Toronto Public Health cannot write the plans for everything that goes on in the city of Toronto, and most people know their own circumstances, know what they need to accomplish, and will work it out for themselves. Right now, of course, we're working on stage 3. It's a little challenging because you don't always get a lot of notice about what is coming back on stream, and then we have to address all of the various needs for the businesses, the activities, and the facilities that are going to be coming back online.
Thank you. That's very helpful. And I like the acknowledging, especially in this group, the expertise that a lot of the event organizers will have about their own local venues, their own local circumstances, their event formats and things like that. And providing all of that guidance from the Costco of guidance, I love that, is very, very helpful. Last, before we open up to the questions from the attendees, Rob, many of the events at U of T require many hands, including temporary workers. So could you tell us a bit more from your perspective on how we can keep everyone safe, and what happens in the event the temporary worker, for example, would become ill? What about David referred to when an event attendee may become ill, and the importance of keeping a list to help Toronto Public Health with contact tracing. Are there any elements like that you would like to tell us about knowing that that eventuality may occur?
Sure. No, it's a perfectly legitimate question these days, because as I mentioned earlier, this is a dynamic situation, and you know, in a certain sense, a lot of we're learning as we go, and we're learning from other jurisdictions and things like that. In terms of the first part of your question, how do we keep, you know, people safe while they're there, temporary workers, things like that? I would just refer back to the comments I made earlier around following just to the general principles around physical distancing, hand hygiene, face coverings, following Ministry of Health and Toronto Public Health directives, and enhanced cleaning. Those are the things that, however you can incorporate those 5 principles into your event, you're going to go a great way towards mitigating the risk of transmission. And it's I guess just to reiterate what Dr. Mowat had commented on about the event professionals knowing the venues that they're going to be at, they will have a pretty good sense then of what's practical, what's reasonable, what can be done in terms of, you know, protecting staff and visitors. Now, the question of whether or not someone becomes ill is an interesting one, because when it comes to occupational health and safety and reporting occupational illness, if it's something that the individual, one of your employees, if they believe that say, for example, somebody tests positive for COVID. If they believe that it is a work-related situation, then there are certain legislated reporting requirements around that as far as the WSIB, their supervisor, and because it's considered an occupational exposure, there also has to be notification to the Ministry of Labor, Training and Skills Development. So those are reporting requirements there. In terms of the care for the individual, if it's somebody who is reporting to work and they're saying they've got a fever or a new cough, things like that, then they need to be directed to either Toronto Public Health, their healthcare provider, for follow-up information and whatever their particular circumstances are. Keeping lists obviously is a fantastic idea if it's possible for people at events, should somebody turn out to later on to test positive, because what I'm reading now in this World Health brief is that there, people who are asymptomatic are able to actually transmit to other people 3 and 4 days ahead of when their symptoms would actually be present. And so this is why things keep on changing. So the important thing though is that if somebody does present with any of those kind of symptoms, that they need to they need to report it, and then it needs to be looked into. And when you're doing these events, for the on-site events, having posters, signage, things like that up, advising participants what's expected at that particular event, because organizations across Southern Ontario are going to interpret these guidelines in different ways. And so we need to be clear that if at a U of T event, if these are the things that are required, it needs to be made publicly available to people, that are there. So even if it's an outdoor event, maybe they choose not to wear a mask, maybe in the opinion of people that are running the event, masks should be worn. That information needs to be posted before people actually come in and enter the event. And in terms of, I think one of the other things that you commented on is obligations from the university. And I know that Gina can certainly speak to this, but essentially, when it comes to occupational health and safety and employer responsibilities, something like this, which is a novel, it's a new type of health risk or health hazard, occupational exposure hazard. Ministry of Labor relies on their general duty clause, which is 25(2)H in the Occupational Health and Safety Act. And basically that just says that the employer has to take every reasonable precaution in the circumstances for the protection of a worker. And so it's important to understand we're talking about what is reasonable, and it's situation specific. It depends on the circumstances. And so again, I reiterate, what is reasonable today based on our understanding may not be the same benchmark 3 months from now in terms of what's reasonable. So we need to be willing and open to be able to adjust our approach.
Yeah, that's really helpful. Thank you. I was actually also thinking of a follow-up to Gina based on what you were saying. And Gina, maybe you could tell us a little bit specifically about at U of T, especially a protocol for if someone becomes ill, a staff member who worked at an event. What are some of the things that a staff member should do? I know it's been in the bulletin brief regularly, which has been great, but it is a question our office, for example, often gets.
Absolutely. So the university has a robust process in place with regards to procedures pertaining to those who are ill and procedures pertaining to those who are either probable and or confirmed cases. So we have a substantive amount of information that's available. We have information available on our general workplace guidelines, thanks Arshana, as well as the bulletin themselves and a myriad of other documents. And so in this particular case, and looking at it from the perspective of events, the process would still apply in the same manner. And so we've been talking about contact tracing, and we've been talking about the process of having a contact list. And so these are all guidelines and procedures that we're going to delineate in our document that we're hoping to launch this week, and very much mirrors what we already have in place in the general workplace guidelines, such that for those individuals, employees that are not feeling well, we have very prescribed processes on what to do, engaging with your supervisor, forms that need to be filled out, et cetera, et cetera. And so those processes would still apply for event organizers who are university. And there's also processes that we also have in place for those that are external parties that are organizing events on our campus. Because again, the university as an employer, we're also responsible for contractors as well as visitors who come on site. So we have robust reporting procedures for all of those, and those are also included in our applicable guidelines as well. In the event that we do have an alleged, probable, or confirmed case, we have a prescribed process for that as well. At the University of Toronto, we're very fortunate. We have an incredible team, and I'm very lucky to have the team that I have, specifically a fantastic occupational health team on standby 24/7, such that if there's any case whatsoever that does arise, or even someone that thinks that they have symptoms or isn't quite sure or has concerns or believe that they have, that they may, or they're getting tested and they're not sure where to go, we understand, and we're here to provide support. And so our occupational health is available, as my entire team as well, 24/7, to be a central point across the campuses, and it doesn't matter whether you're an employee or a student, that you contact our occupational health nurse, and truly it's as simple as that. We're trying to make it as simple as possible. Simply contact our occupational health nurse, and they will guide you through the process of working through your specific concerns in context of public health directions. And then we work in tandem and collaboratively with the applicable person. So that will include the appropriate supervisor, as well as possibly the unit lead if it's applicable. We engage accordingly with public health officials as well. And it is our occupational health nurse who conducts all contact tracing for the university. And at times we do that fully independent of public health and or in tandem with them. So it's quite dynamic, it's quite iterative, it's constantly changing, but we endeavor to make things very simple such that if you have concerns, if you're not sure, if you're not feeling well, not a problem at all. We have materials in place, and when in doubt, you can simply contact our occupational health nurse for directions to ensure that we're following institutional procedures which are in keeping with public health directives.
Thanks, Gina. That's really helpful. I want to return to something that David said in his remarks, and also Chad alluded to sort of the changing format of events. And I wanted to go back to the question of food and drink. And the others may have something to add on this point as well, but I'll begin with you, David. If you could tell us a little bit about what the general guidelines are, I mean, based on the current situation and what we know regarding the handling of food and beverages for conferences and meetings. Like, I'm noticing a lot of prepackaged food. I'm noticing no more buffets, no more passed trays. If you could tell us a little bit about that.
Certainly. Well, let's start by saying it's still food. So all of the precautions you would take before COVID around assuring that food was uncontaminated, as healthy as possible, will of course still apply. Keeping the cold foods cold and the hot foods hot, etc. As far as COVID's concerned, what we have, I think, is an issue here of science and how quickly we can get to know things. And I think we're all agreed that we've never done anything like this before. It's happening very fast. There's a lot of new knowledge coming in, some of it good, some of it not so good. We're trying to make sense of it. And our picture of how it transmits is constantly changing. I think the consensus now is that overwhelmingly it's the direct transmission by droplet spread. And the aerosol spread is still controversial, but certainly droplet spread is by far the most important way that it spreads. Surfaces, not as important. And food, there's essentially no evidence at all that it spreads by food. Nevertheless, we, I think, appropriately applying the precautionary principle that when we really don't have good evidence that it's safe, until we get better evidence, we're going to err on the side of caution. And I think everybody's agreed that that's the sensible way of doing it, given that it's, you know, those measures that you put in place are fairly harmless. So yes, indeed, everything now is pre-packaged, minimal handling, buffets gone totally, and may not come back for years. So that's how we're doing it now. There is guidance, you know, more detailed guidance on how one handles this. Some of it very elaborate. It's my belief that we have to keep things as simple as possible. I don't think the human mind that's going out to do their conference on whatever, you know, probably intellectually challenging subject that they're doing at U of T also has the capacity left to concentrate totally all the time on not touching things. It's just not the way we are. So as safe as we can make it ahead of time by planning it properly is fine. But don't be afraid of food. And I think if your food is served as it will be in individual servings and disposable containers, I think you can certainly relax.
Thank you. That's very helpful. I just saw a picture. I love basketball, as all of us probably, because they're Raptors. And the NBA bubble, they receive meals to players while they're in isolation on sort of airline trays. I was thinking, wow, that's, you know, it'll be interesting to see how long this will go on. But you're right, we may not see buffets for a while. My next question kind of goes to a specific concern of events planners, which is around attendance. Often for events planning purposes, especially when they're free, it's a bit tricky to estimate who will show up. So often there may be overselling of tickets to ensure that there would be attendance in person or a full house. How would you all kind of think about this practice and whether it should be reevaluated in light of things like physical distancing, contact tracing, documentation? So setting up a wait list, for example, or how to calculate maximum capacity, thinking about charging events when we might not have in the past. So questions around this idea of capacity. Maybe Gina, I'll begin with you, and then if others, perhaps Rob, you might have some guidance from your work, and David as well, and Chad when it comes to people's concerns about comfort and safety and planning. Gina, why don't I start with you?
Sure, thank you. And my apologies. I'm in an area of bad reception, so there was a little bit of choppiness. So Arshana, if I understand correctly, what we want to focus on right now is a discussion on how to maintain kind of the integrity around, you know, comfort, around wearing masks at different types of events. Did I hear that correctly? Because it's choppy on my side.
Oh yeah, not just masks, that might be one element, but really planning for capacity when you know rooms attendance limit, and normally events planners, we might oversell or put more tickets on Brightspace than are available, knowing that especially for free events, people may not turn up. So how do you plan for capacity and knowing who's in the room for tracing in the future if needed, while also kind of preserving the flexibility to attract people to attend for a full house?
Absolutely, and this is a conversation that we've had quite substantively as we put together our events guidelines. So we are working. We have several working groups. One is specifically with regards to our space planning folks and those that oversee different types of spaces, classroom spaces where events may be held as well. And what we've endeavored to do is to have a very clear understanding of specific rooms and their capacities. And what we're endeavoring to do is proactively work together with our space management folks, together with our property managers, together with our unit leads, and specifically trying to target all of this good guidance into our events guidelines. And so the provision of some of the information that we're providing are specifically looking at capacities of particular rooms, providing those resources on how to calculate spaces in rooms in a very consistent and systematic manner, in conjunction with how the university in general is assessing those space limitations and capacities, providing that information in the events guidelines as well as in the general workplace guidelines, and of course ensuring that not just health and safety is available and on site for any kind of assessments that arise, but also our folks together over at property management as well as our facilities and services folks across the campuses. And so I think what's important to also bear in mind as well is that within our guidelines, we're going to have an events assessment tool. And it's going to be a really important tool, very much mirrored based on the tool that we have in the general workplace guidelines, that specifically walks through each of the variables that need to be considered in order for an event to be approved to go ahead and proceed. And so that's exactly what we go through. We go through items such as ensuring that you understand the capacity of the room, looking at modes of egress, how to very creatively use cues to deal with people that are lining up, waiting to come in and out of an event, how to deal with issues such as breaks, considerations specifically around food, ensuring that we're maintaining and in context of all of the public health directives, and several other really important points as well around how to configure the space, how to maximize a space creatively in a way that still creates a comfortable environment, but still maintaining the integrity of physical distancing measures. As you can imagine, it's incredibly dynamic. Our processes are going to be iterative, and we're going to have to be agile and, of course, very patient and kind with one another as well as we work through it. But we're endeavoring through our events assessment tool within our events guidelines that this is going to be a one-stop shop, a place where all event organizers can go. They can work through that assessment. They can contact us for help, and we will guide them in a way that's systematic, and ensuring that processes across the campuses are consistent and accordingly. And of course, again, we do ask folks to bear in mind that those guidelines that we put out are going to change, and they are going to have to be agile. And so we do ask for everyone to have a collective set of patience and kindness towards all of us, because whatever we put out, just like with any other document that we put out as far as guidance, is iterative and it's going to change. But stay tuned. And of course, once we put out that our events guidelines, it is also considered very much still a live document. So we welcome additional questions. We welcome the ability to have further discussions on different variables that people want to bring forward. And we're going to incorporate those as we go into that events guideline document for everyone.
Thanks, Gina. You mentioned masks. I'm going to ask Rob if you could say a couple of words about masks, and David as well from the city's perspective. So the current Toronto bylaw around masks exempts post-secondary institutions, but U of T, as you will have seen in the U of T News article, does require the wearing of masks indoors in publicly accessible spaces like the lobbies, waiting areas, things like that. I was wondering if you could both tell us a little bit about face coverings a bit more. One specific question that's come in is around food and face covering. So if an event is going to have food, let's say it's prepackaged, do you recommend setting aside a separate area, for example, where people would eat because they would have to remove that face covering? And Gina, you might also have a word or two to say about this, about U of T's perspective on masks. So I'll just go around. Maybe we'll keep our comments to like 30 seconds or so each, and then we'll have to unfortunately wrap up, but we'll try to collate the remaining questions and have our panelists give us some resources in the email that we'll send out after the event. So why don't I begin with Rob on masks for a few.
Okay, yeah, I'm not familiar actually with the City of Toronto's bylaw, whatever was referenced there in the Q&A as far as universities being exempt. I defer to the provincial guidelines and the provincial directives that speak about closed spaces and things like that. And again, when it comes to health and safety of workers, I revert back again to my comments earlier about what is reasonable. And because that really is the measuring stick. And is it reasonable to expect people or require people to wear a mask that there is shown efficacy that it actually does prevent transmission? Is that a reasonable thing to do? And then if the university chooses not to do that, then obviously that's the university's choice. But again, I look at it from the point of what is reasonable in the circumstances. And in my view, wearing masks in large gatherings, whether indoors or even outdoors, that's my view, is an appropriate mitigation strategy. I'm not aware or familiar with the food context. Perhaps Dr. Mowat or someone may be able to comment on that.
Yeah, thanks. David?
The City of Toronto's bylaw, which is very new, but is one of many being brought in across the province. I think just about everywhere in Ontario has similar bylaws now. And it's trying to address where the maximum risk is, which is indoors, in public places where there's likely to be more people. It doesn't, for example, affect office buildings. It's where the public go. So it's retail, obviously, would be the big one. And we're talking about non-medical masks in order to conserve the higher grade masks for healthcare providers. And these masks have a limited efficacy in terms of protecting the wearer against infection, but definitely have efficacy in terms of what we call source control, which is making sure that the person who is excreting a virus that is stopped from spreading very far away from their mouth. I mean, it's common sense that would be the case, and it is indeed the case. And if it does require a very large proportion of the population to actually comply to really make a significant difference. But we do see that when it's expressed in the terms of a bylaw, for example, then Torontonians, being Canadian and apt to comply, do use them. And especially important, obviously, in close quarters. That's why it's so important on the TTC that everybody wears these. As for eating, we're very relaxed about the fact that people would have to take them off to eat and drink. And we're not getting excited about that. A separate area for eating is a nice thing to have, but I don't think it's that essential if we are also maintaining that 2 meter distance, which we should be doing at all times. So I want to stress, the mask is not a license to get closer than 2 meters. It's an additional protection.
Thank you. That's really helpful. I'm going to have David have the last word there because I know we're at time. I want to thank all of you, our amazing panelists, for helping us to begin this process of thinking through the many complexities of restarting in-person events at U of T in this new normal. So Chad, Gina, Rob, David, on behalf of all of the attendees today, we appreciate all of your advice during this session. I also really want to thank Lara and Nini for organizing this event, and also Daria and Adam, who you didn't get to see or hear from here, but from the Monk School, for handling the technical details of this session. And I'd like to thank the entire U of T Events Professional Organizing Committee. We hope that all of you enjoyed this session. Of course, the conversation continues through your team's group and through a networking event on July 22nd. That will be the final closing event for this series, and an email will be going out shortly with all of the details about that event. I just think it's amazing you have this group and this network to share ideas with. So congratulations and thank you to all of you for your work at U of T. We'll be emailing you all the links to the different guidelines and the timelines of when to expect more of those guidelines, as well as some follow-up Q&As if we can put that together for you as well. So thank you so much. And we hope to see you guys soon.
Thanks, everyone.
Thank you.
All right.